This resource has been developed by clinical specialist physiotherapists within the Southern Health and Social Care Trust. Our role as physiotherapists is to rehabilitate patients so they can return to their previous activities or daily routine.
The purpose of this video is to provide information and practical help in dealing with symptoms of persistent low back pain. The World Health Organization has found that 60 to 70% of people will experience low back pain at some point in their lives, meaning it is a very normal part of life. Although it can be very painful and worrying, in most cases it is not caused by anything serious and will usually improve with time. For some people, it may last for a longer period of time or come and go over time. It is important to remember that our spines are not that vulnerable to damage. They are designed for movement such as bending and lifting, and although they can get injured, we can be confident they can also get better. It is uncommon for back pain itself to be a symptom of a more serious underlying medical condition. This accounts for only 1% of all back pain worldwide. Specific accompanying signs that may be a cause for concern are outlined for you at the end of this video. These are circumstances when it is appropriate to seek further medical advice, and we advise that you would speak with a healthcare professional if you experience any of these. On the other hand, in the absence of these symptoms, you can feel reassured that pain is unlikely to cause harm, and it is both safe and beneficial to exercise. It is important to remain as active as you can and continue to do your normal daily activities. Resting or staying in bed for prolonged periods of time will likely make the pain worse. Change position frequently, get up and move around. If you're struggling to manage your pain levels, it is appropriate to speak with your GP about pain relief. Managing your pain well is very beneficial in the long run. You may find the use of heat, such as heat pack or hot water bottle, can give you relief in the short term. It is important to point out, research shows strong painkillers do not provide greater pain relief over simpler options, but do have a greater potential for harm. There is very strong evidence to show that exercise and movement are the best ways to reduce and manage low back pain. In this video, you will see examples of things you can do at home in order to help the flexibility and strength of your back. It can take time to see improvements, so try and get into a good routine with the exercises and be patient. You might find it useful to keep a track of your symptoms and the exercises you do in order to be able to see your progress.
We understand that patients may experience a range of symptoms in differing severities, but this video can be used by all patients. Attention should be paid to your own ability, with exercises modified accordingly. We hope that the information and advice provided will assist you with beginning or progressing your rehab journey. It is important to begin all exercises at a level that feels comfortable to you. It is normal to feel mild discomfort during or after exercises, especially if it is something that you haven't been doing before. If an exercise causes sharp or severe pain, discontinue that specific movement and discuss this with your physio. You may be able to try it again later in your rehab. Take your time and set small goals. Aim to do a little more each day, progressing both repetitions and intensity as you feel able.
We have included different levels of exercise which require gradually increasing levels of strength and mobility to perform. Watch the exercises carefully before beginning the exercises yourself. We recommend that you aim to work up to 8 to 10 repetitions of each exercise and 3 sets of the exercises spread throughout the day.
These exercises can be done on a mat on the ground or on your bed. Bring your knee in towards your chest, hugging it in as much as is comfortable. This can be done on alternate sides.
core both knees together. With your feet on the ground, keeping your feet and knees together, allow your knees to roll from side to side, feeling the stretch in your back. Plant your feet on the ground, squeeze your bottom muscles together and lift your hips up towards the ceiling. Lifting the hips up, rolling the spine slowly, up and down. Coming onto your side. Stacking your hips, knees and feet on top of one another, keeping your feet together, lift your uppermost knee towards the ceiling. This can be done on alternate sides. These exercises can be done in standing. Tuck your chin in towards your chest and roll slowly down, reaching towards the ground as far as is comfortable. Return to your starting position slowly. Tuck your chin in towards your chest, rolling down, reaching towards the ground as far as is comfortable, and rolling back up slowly to your starting position. Place your hands on your hips or in the small of your back and lean backwards, looking towards the ceiling. Reach down side to side, imagining that you're allowing your middle finger to trace the side seam of your trousers. Using a wall to support your back, bring your feet about 12 inches away from the wall and slide the back down the wall into a seated position as far as is comfortable, sliding up and down. Sit to stands can be done with any chair, either using the arms of the chair for support or without support by placing the hands in the lap. Lunge forward on alternate sides, aiming to bring the back leg parallel to the floor. Step-ups can be done to any step, alternating the leg which leads the movement.
As stated before, begin gradually and build up what you can do. There may be some exercises that you really enjoy doing and that bring relief to your symptoms straight away. You can do these movements frequently throughout the day.
It is widely accepted that exercise is beneficial for both your physical and mental health. It is normal to experience feelings of muscle weakness, stiffness, fatigue, or lack of energy during or after exercise. These symptoms do not relate to muscle damage, and exercise do not make these symptoms worse. It is important to exercise your body in order to improve your strength and ability to do normal tasks. Exercise is also a very useful way to manage feelings of stress, anxiety, or worry. Therefore, we would encourage you to do some form of activity that you enjoy each day. We hope that you have found this video to be beneficial, and if you have any questions, you can speak with your physiotherapist.
We advise you to speak with a healthcare professional if you have low back pain and any of the following: a past medical history of cancer, unexplained weight loss, constant pain that does not vary, severe night pain, trauma or fall, pins and needles in both legs, a medical history of tuberculosis or osteoporosis, feeling systemically unwell, There is a very rare but serious medical condition, cauda equina syndrome, which can lead to permanent damage or disability. Please make yourself aware of the warning signs and guidance listed below. Cauda equina syndrome warning signs. Loss of feeling or pins and needles between your inner thighs or genitals. Numbness in or around your back passage or buttocks. Altered feeling when using toilet paper to wipe yourself. Changes when you try to urinate. Changes when you try to stop or control your flow of urine. Loss of sensation when you pass urine. Leaking urine or recent need to use pads. Not knowing when your bladder is either full or empty. Inability to stop a bowel movement or leaking. Loss of sensation when you pass a bowel motion. Change in ability to achieve an erection or ejaculate. Loss of sensation in genitals during sexual intercourse. Any combination or number of these warning signs could be symptoms of cauda equina syndrome. Please seek emergency medical help within 12 to 24 hours.